All right, it is 12:01, so we're going to go ahead and get started. My name is Misty Harmon. I'm a family and consumer science educator in Perry County, and we are so happy to have you.
I'm Pat Brinkman. I'm family and consumer science educator in Fayette County and also an associate professor.
And again, we're so happy that you're joining us today. February is American Heart Month, and so we are so proud to be able to offer this series of webinars about heart health. And this is one of a series of three, so make sure you mark your calendar for those upcoming ones, and we'll let you know when those are. So again, we're gonna talk about steps to a healthier heart overall. And as soon as my clicker moves here, there we go. This is a requirement of programs that Extension provides. So this is the USDA and Justice for All poster. So we just put that up there. If anybody wants more information about that, we can certainly provide that. So our goals today in the first part of this series is we're going to look at the different types of heart disease, because heart disease is a big term. And again, we're going to look at that. We're going to look at the importance of preventing or in reducing coronary artery disease. And so you can see that CAD, a lot of times you'll hear that term. And then we're also going to look at some health habits that may improve your overall health. So those are our goals for today. So first of all, we'd like to get your input as to, do you know someone who has heart disease? And while Amy's pulling that up in the poll, I'm just going to give you a few little statistics about heart disease here in the United States. Heart disease accounts for nearly 1/3 of all deaths in the worldwide, and is the leading cause of death in the US and also in Ohio. Ohio actually has the 13th highest rate of cardiovascular disease in the US as of 2016, at least. Those were the latest statistics. And cardiovascular disease is also the world's most expensive cause of death, and it costs the United States nearly $1 billion a day. Not million, $1 billion a day. So, this is why, this is a really important topic for everybody to understand and to know, because it is very costly. And it looks like, the majority of you, and if you're having trouble with that poll, you can type it in the chat if you want to. Sometimes certain devices don't let you see that poll. So you all can continue to do that. And I'll just start on the next one. And Amy, you just let me know when that's done. So again, heart disease describes a range of conditions. So we're going to look at some of those today. Some of them we'll just kind of go over quickly, but then there's a couple we're going to focus on a little bit more. And coronary heart disease, or CHD, as you see there, is the most common type of heart disease. And this actually occurs when plaque builds up in the arteries to the heart. So our heart has its own supply of blood vessels that feed it. And when those blood vessels that supply the heart with blood and oxygen become blocked, then you have what's known as coronary heart disease. And again, the heart doesn't get enough blood and oxygen, and heart attacks can result in that because of that reduced blood flow to the heart, as well as people may have chest pain and some of those other symptoms that might lead them to, the doctor or whatever that is. So the heart, again, is not getting enough blood and oxygen due to that buildup of plaque in the arteries. And over time, coronary heart disease can actually weaken your heart muscle. It can cause other issues like congestive heart failure and arrhythmias, which we'll go over a little bit. Congenital heart disease is another type of heart disease. And actually this week is Congenital Heart Defect Awareness Week, February 7th through the 14th. So that's a perfect time for this. But this is a problem with the heart structure and function, and it is present at birth. It is the leading birth defect in the US. And again, it describes a variety of conditions. So there are lots of different kinds of congenital heart disease. So it is a term that encompasses a lot of things itself. Peripheral artery disease, much like the vessels that feed your heart can become blocked by plaque, the vessels that supply other areas of your body can also become blocked by plaque. And when that happens, that's called peripheral artery disease. So oftentimes that occurs in the legs or the feet. It can also happen in your kidneys and in other areas of your body. And again, it's when those arteries that supply those areas are reduced, the blood flow is reduced because of that plaque buildup in there. So, people may get get pain in their legs when they start to walk or walk for very extended periods of time. And the treatments are very similar to coronary heart disease. They can do stents and they can do bypass on those. So again, just depending on what, is appropriate for that person, they would have those different kinds of interventions. And then stroke is another type of heart disease or vascular disease. And this is actually when the vessels that supply your brain become blocked due to that plaque buildup. So, again, 3 of those up there are the same process. It's just depending on where they are, we call them something a little bit different there. Another way you can also have a stroke is if the blood vessels actually burst, and then that's hemorrhaging. But the most common, one is that plaque buildup in those vessels that supply the brain. And again, there's different procedures that can help that. Oftentimes people may have what's known as TIAs, and those are called transient ischemic attacks, kind of like when somebody is developing heart disease and they may get chest pain when they start to walk or something like that. A transient ischemic attack is the same type of thing happening in the brain, where it's a kind of a warning sign of a potential impending stroke or larger stroke. And stroke is the 4th leading cause of death in Ohio, just to let you know. So again, these are really important topics because many people will have these. And again, if you don't know somebody that has them, it's likely that you will. I'm clicking my thing there. All right. Some more heart diseases, congestive heart failure, which I kind of mentioned earlier. Congestive heart failure, it doesn't mean that your heart stops beating per se. It means that the heart can no longer keep up with pumping blood out of it. And so it can get stiff, so it doesn't contract well, or it can get stretched out, kind of like a rubber band that's lost its elastic and it doesn't snap back. So, congestive heart failure, again, has a couple different mechanisms that can cause that, but certainly it is a very debilitating disease as it progresses. People have a lot of trouble with functioning in there. And so again, it affects the ability of the heart to get blood out, to the rest of the body or to the lungs, depending on the side of the heart we're talking about. Arrhythmias have to do with the electrical system of your heart. The electrical system of your heart is actually what tells your heart when to beat and how fast to beat. So if there is a problem with that conduction system as it goes through your heart may not beat as regularly as it should. It may not beat as fast as it should. It may beat too fast. And again, depending on where in the heart that occurs, it can lead to shortness of breath, dizziness. People can pass out, and oftentimes if you've had a heart attack or a coronary heart disease, if there's an area of your heart that was impacted by that, it can also impact that conduction system in that area. So we often will see arrhythmias, in patients who've had significant heart attacks, because that area of the heart that was damaged also affects that conduction area as it goes through there. Valve problems, and as you can see on the screen there, those valves are the trap doors that block the chambers and keep the blood from going backwards. So they open one way and they allow blood to travel through your heart in one direction. And sometimes those get weak and they don't close all the way. And so blood will kind of go backwards. So when your doctor is listening and he's moving the stethoscope, or she is moving the stethoscope around your heart, they're listening for a specific sound in there to diagnose if you may have a valve issue. So again, when they're, it doesn't seem like they're moving that very far, but your heart's only about the size of your fist. So it's not a very big organ to begin with, but they can tell in there if there's a gurgling or a murmur, that might indicate that you have an issue with those valves. And again, depending on where in the heart they're hearing that sound, they would know which valve is likely impacted by that. And, people, again, these can result from different things. People can be born with a valve issue. Different viruses can cause valve issues, and some of the other heart conditions that we've already talked about can cause valve issues. And then there's sometimes people just have them and we don't really know what caused those valve issues. And then lastly here on this slide is hypertension or high blood pressure. And what a lot of folks don't realize is that, this is considered under that umbrella of heart disease, or cardiovascular disease is probably a better term because it has to do with the vessels in your body, as many of those other conditions I talked about do as well. But hypertension and high blood pressure is the force exerted against the walls of your arteries as your heart pumps blood out. And high blood pressure is the most prevalent type of heart disease, believe it or not. So, for those of you who may have thought coronary heart disease is actually high blood pressure is the most prevalent. And with about 45% of the population diagnosed, and that's just the ones that are diagnosed. So we have people who haven't yet been diagnosed with that. So it's probably even higher than that. And so we're going to talk a little bit more about that. And I'm going to turn it over to Pat now.
Hi, thank you. And next slide. What affects your blood pressure? Do you have any ideas? Maybe some of you have high blood pressure and you have you kind of know what affects your blood pressure. You can type part of those in here we have it. Have a poll and you can multiple choice it, okay? So you can pick more than one. And we'll see kind of what you come up with here. Looks like you're doing fairly good right now. Give you a couple more seconds on the poll, maybe. Most of you maybe have finished it. Okay. Share the results here. So you are correct. Actually, all of these does affect your blood pressure. The age, the family history, race are ones we cannot make any changes in. I mean, we're stuck with whatever we have there. So we don't have options on those, but we can make some differences. And how, our weight affects our blood pressure. So does physical activity. Using tobacco will make it worse. The sodium intake they're going to talk about in the next webinar. So not this time, but we'll talk about it next time. And stress, and then chronic conditions. So stay tuned. If we don't talk about it much this time, we'll be talking about it next time because it will make, they are important parts. Another one too is potassium levels can make a difference. And that also has to do with your sodium levels in your body too. So it kind of goes together there. High blood pressure is called a silent killer, and that's because it can damage your organs without you really even knowing you have it or that it's a problem. And it can really make a difference. A lot of people who have hypertension also end up with other organ or chronic conditions because of that. And one way you can start to think about this kind of is unusual. Misty had not heard this one before, so I'm going to share it. When you get underwear, it's real stretchy and easy, and it goes on, it stays up, no problem. But as you wear the underwear and you use it, you wash it and everything else, after a while, that elastic kind of just doesn't work as well. And suddenly then it gets all worn out and older and it just falls down. And that's that same thing that can happen with your heart, in the fact that that's pushing out against the walls, the blood against those walls that has resistance so much that then it kind of wears down and wears out. So it's important to try to make sure we find out if we have hypertension and keep it under control. Next slide, please. So people don't typically have any signs or symptoms until they have a heart attack or stroke. So it's important that you have your blood pressure checked, because that is what really keys you in on if you have hypertension. And the normal range of blood pressure is less than 120 systolic, which is the top number, over 80, which is systolic, which is that bottom number. So that's where we want our blood pressure, at that level or below. And if you look on the next slide, you'll see that we consider high blood pressure not far from that 120. It goes 130 over 80 is considered higher for any length of time. So if it lasts over a different period of time. And if you have symptoms, or when you're in your doctor appointment and you take that blood pressure and it's over 120, they'll probably have you come back in a couple weeks or so and have it checked again. And they usually say 2 or more checks that are above that 120, then they really want to see what you need to do to maybe consider controlling that. And things you need to watch out for are ways to control your hypertension, being at that healthy weight, lowering your sodium intake, we'll talk about next time, increasing your physical activity, coping with stress. We all know stress really wears on our bodies, limiting alcohol, avoiding tobacco, and if the doctor recommends medication, be sure and take it. You may not feel you need it, but it can make a big difference in protecting your organs and everything. So next slide. Another thing that affects our bodies and really we need to watch out for is cholesterol, because high cholesterol puts us at higher risk for heart disease. Cholesterol is the waxy type of fat or lipid that moves through your body in your blood. Lipids are substances that do not dissolve in water, so they do not come apart in the blood. Your body makes cholesterol, but you can also get it from some foods. Cholesterol is only found in foods that come from animals, so meat, milk, dairy, butter and cheese. Those are the high cholesterol foods, we'd say, usually. And every cell in your body needs cholesterol because it helps that cell membranes form layers. And these layers protect the contents of the cell by acting as gatekeepers to which things can enter or leave the cell. Cholesterol is made by the liver. It's also used by the liver to make bile, which helps you digest your food. Cholesterol is needed to make certain hormones and produce vitamin D. Your liver makes enough cholesterol to meet your body needs, so you don't have to eat it necessarily to get it, okay? So what we consider good, healthy total cholesterol levels, and when you get your cholesterol levels usually measured, you'll get a total cholesterol, an LDL lipid, we'll talk about an HDL lipid, we'll talk about those in a minute, and then also maybe a triglyceride and other lipids, okay? But what we look at right now is that healthy total cholesterol. And we want it to be less than 200. That is the goal, unless you have other problems and your doctor is recommending a lower amount. But we really want it to be at that lower level. So if it's borderline between 200 and 239, they're probably going to be watching you and checking and say, come back, we'll do it in another 3 to 6 months and check it again. If it's high, then they may put you on some medication. So be sure and take the medication, or they may have some other recommendations for you. Next slide. So LDLs, I mentioned a minute ago, and HDLs is what that total cholesterol is usually measured of. LDLs is what we consider low density lipoproteins, and they're considered that bad cholesterol, what we don't want, because it builds up as plaque and other things on our arteries. And then we have HDL, which is high density lipoproteins, and there are good cholesterol. We're going to do a little more information here. So the LDLs build up on the walls of our arteries and make them narrower. The fatty deposits form plaque that line your arteries and may cause blockages, which is arteriosclerosis. The fats linked to LDL cholesterol and those you can minimize in your diet are usually saturated fats and trans fats. Saturated fats are solid or wax-like when they're room temperature, so they don't melt down all the way, like oil does. They are mostly found in products such as animal products such as meat, milk, cheese, butter. Trans fats are the result of liquid fats put through the hydrogenation process to become solids. There are a lot of times they've been found in fast foods and fried foods, and the US government is making people take them out, but you may still find some around, okay? They're also a lot of times in processed food like cookies, crackers, bakery items, because they extend the shelf life, so they make things last longer on the shelf. Our next one part is the healthy HDLs, and those are the ones we want high, okay? And there are good cholesterol. They carry things away from those, they carry the bad LDLs away, if possible, from the arteries. You might think of an HDL as a delivery truck, while thinking of LDLs as a dump truck. They dump things in your arteries. The HDL tries to carry them away. And it drops them off at the liver, and they can be then removed from the body. It's better to have a high ratio of HDLs compared to LDLs. So your doctor may talk about a ratio. We really want for sure at least 40 for men and 50 for women here, but the higher kind of the better in this case, okay? So ways you can increase that HDL is exercise, being active, avoiding tobacco, limiting your or maintaining a healthy weight, and increasing your intake of vegetables and fruits will sometimes help too. Okay, another type of fat in our blood is triglycerides. And these may cause hardening of the arteries also. They increase your risk for stroke and heart disease. So triglycerides, the normal level is at 150, next slide, please. The normal level is at 150 milligrams. Your body eats, when you eat triglycerides, it's a type of fat, but when you eat it, your body converts any calories you don't use right away into triglycerides. Triglycerides are stored in your fat cells. Later, hormones release triglycerides for energy between meals. So this helps you maintain an energy level, you might say. If you regularly eat more calories than you burn, particularly from high carbohydrate foods, you may have high triglycerides. Okay, so a simple blood test can reveal whether your triglycerides fall into the healthy range. And you can see there the different ranges and how we want to keep that lower level. Ways you can help work to keep your triglycerides lower are lose weight if you're overweight, eat a healthy diet low in saturated fat, cholesterol, and calories. So same thing for our other lipids. Stop smoking, exercise at least 30 minutes, 3 times a week or more, and then limit alcohol and limit simple sugars such as candies, sweets, cookies, so regular soda, baked products. So those are things we want to kind of keep under the limit so we don't spike up that triglyceride level. So Misty, back to you for the rest of these slides.
Thanks, Pat. Diabetes is another condition that will increase your risk of heart disease. So we wanted to kind of review it as well. And type 1 diabetes is when there is no insulin produced by the pancreas. Oftentimes this is diagnosed in children, but it can occur even in adults, but not as frequently. That type 2 diabetes is what's more common, and that is insulin resistance. So the pancreas is releasing insulin, but our bodies become resistant to it. It doesn't use that insulin well, and insulin opens up the cells and allows blood sugar to enter the cells and be used for fuel. Used for energy. And then prediabetes is a higher than normal blood sugar. And we're going to go over the ranges here in just a minute. So, again, if you've been told that, you want to really be careful. And all of the things that Pat's already mentioned for triglycerides are the exact same things that help with diabetes. In fact, oftentimes people with diabetes will have high triglycerides because of that elevated blood sugar that's kind of running higher. It will make their triglycerides be a little bit elevated as well. So, everything that she just mentioned are the same things that you can do for diabetes. And again, that's regardless of whether it's type 1 or 2 or pre-diabetes. So with that fasting glucose, we're really measuring a single moment, in time. So we're going to look at a couple other measurements as well, but the normal fasting blood sugar should be less than 100. If it's 100 to 125, then that's considered prediabetes. And prediabetes is kind of a warning, that you're headed down the road. It's not that you will develop diabetes, but you're at risk of developing diabetes if you don't make some of those changes that Pat already talked about. And then diabetes is considered a fasting blood sugar of 126 or higher. And if somebody already has diabetes, they're going to be working with their physician to determine what's the best level for them. Because oftentimes, if a person with diabetes has good control, their blood sugars will fall into that normal range. They just require that medication, like Pat mentioned with high blood pressure. It's the same thing with diabetes and with cholesterol. If you need a medication, you definitely want to take those medications. I actually worked in cardiac rehab for 22 years. So, I saw a lot of patients who didn't take their medications the right way or at all because they didn't think they needed to. And really, it's imperative for that control. So hemoglobin A1C is gives us a little bit more information because this is an average glucose. So it looks at the red blood cells over the last 90 days or so, and it can determine what the average glucose is as opposed to just that one moment in time when you're fasting. This is looking at after you've eaten, when you're sleeping. It's kind of doing an average of all those highs and lows. And again, depending on what that range is, when you get your blood work done, the doctors can tell whether you're again in that normal pre-diabetes or diabetes range. And again, this is just it's a busy thing here, but it just kind of gives you that hemoglobin A1C in that first column, your fasting blood sugar, and then your glucose tolerance test, which is another type of test often done with pregnant women to see if they're at risk of developing diabetes, but can also be done with people, just regular people. So it gives you all of the values where those should be, depending again on what test you're looking at. So with all of these things that we've talked about, you really want to work with your physician and discuss what your risks are. Just because you have some of these things doesn't mean that you will develop heart disease. It just means that your risk is a little bit higher than somebody who may not have these things. So you definitely want to work with your physician in reducing those things. And certainly at the beginning, Pat talked about, those ones that we can't control. I have a family history, so that's something I can't control. So I have worked, hard on some of the other ones that I can to reduce my risk of developing heart disease. So certainly, again, that's what we want to really focus on are those ones that we have that control over. And again, this is just a quick review. Some other steps to take in addition to the managing those chronic conditions that we just talked about is a great way to work towards a healthier heart. Certainly taking medications if those are indicated and all of that. As Pat mentioned a couple of times, not smoking. We know smoking is one of the worst things you can do as far as your heart health is concerned. So we definitely want to refrain from that. And if you do smoke, working on quitting. Certainly exercise has tons of benefits in it, and it definitely benefits your heart. Eating healthy, and as Pat kind of alluded to, the next part 2, they're going to talk more about that nutrition and the types of foods to eat for your heart specifically, and why certain foods are good for your heart. So tune in a couple weeks for that. Again, maintaining a healthy weight, reducing and managing stress, and the last one we'll kind of talk about these ones a little bit more, and then practicing good hygiene. What people may not realize is, if we don't have good hygiene, there's bacteria that can grow in places, and that bacteria can transfer, and it can actually get in your heart and cause issues with your heart. So making sure that you're getting like your dental checkups and brushing your teeth, and then some other types of hygiene, because that the bacteria found there can actually go in your heart as well and impact it. So we really want to make sure we're practicing good hygiene as well. And so what we now would like to know is, did you learn new information from today's session? And Amy will launch that poll for you all. And again, if you have any questions that we didn't answer, feel free to type those in the chat. As people are responding to the poll here, we will see. And then again, the next one, which is already on the poll there for us, is do you plan to use the information you learned from today's session? And you can type in the chat if there's something specific that you plan to use. So, if there was a specific thing that kind of came up that you're like, oh, I'm going to do that. And I know we're at 12:30. So if you need to jump off, we're just going to review the resources here. Of course, our Live Healthy, Live Well blog, if you like information more about healthy living. We also have a Facebook page, and we can certainly send these out to you, after this, because I know it's difficult to write those all down, or if somebody wants to pop those in the chat, one of my moderators here. And we also do text messages. So twice a week, you would receive a text message about some health related topic. And then these are our sources. And again, don't forget, 2 weeks, Lisa Barledge and Emily Marison are going to go over Steps to a Healthier Heart Part 2. And this will look at the nutrition aspect of that. And we just want to thank you all for joining us today. And again, here is mine and Pat's information. And we want to thank our reviewers as well, Lisa and Emily. They will be your presenters in 2 weeks for this session. So again, if anybody, my chat comes up over here. So, all right, so they have popped those things into the chat. Somebody's going to contact their doctor about their A1C. Fantastic. Does anybody? And again, if you want to stay on, Pat and I will stay on for a little bit. If you have questions, certainly you can always reach out to us at another time. Can you access the training slides? Amy, do you send that out afterwards? Sorry about that, Regina.
I will be sending y'all a list of our registrants so that we can send out a follow-up email with the recording as well as the resources. So everybody will have some sort of access to all of this information.
Thanks, Amy.
Thank you.
Eat less red meat, Ken. Fantastic. And again, if that nutrition, is interest, if that's an interest, definitely tune in 2 weeks when Lisa and Emily kind of go over some of the more specific foods that are beneficial for your heart. And why they are, looking at that a little bit more. Pat and I kind of alluded to it a little bit today, but they'll really go in more detail with that.